Welcome everybody to Queued In. We're excited about being here today and showcasing UVA Health and their careers. Feel free to use the chat box at any time during this presentation to just really talk to the UVA Health, the representative here at UVA Health. Also, feel free to go to queuedin.us, that's cuedin.us, and take a look at UVA Health's profile. You'll find over 10 jobs that they have. They have a lot of openings, and they're an incredible company that we've heard in the community there in Charlottesville. So without further ado, I'd like to introduce Ms. Pamela Thomas, who is the talent acquisition here at UVA Health, to join us and to talk further about what you're offering there at UVA Health and what you guys and how these students and young professionals can get into a career there. Welcome, Pamela.
Thanks, Seth, and I'm really excited to be part of this presentation today. Let me just give you a little background. My name is Pamela Thomas. I am one of the recruiters for UVA Medical Center. It's a health system, but basically it's one entity. The new name is now UVA Health. And in the past, it's been the University of Virginia Medical Center, but we've actually morphed that into the UVA Health. The reason I would like to talk today is we have many opportunities. When a student graduates from high school, some go to college, some do technical programs, and some just want to get out in the workforce. What I'm going to talk to you today is about what opportunities we have at UVA Health. We are a level 1 trauma center located in, of course, beautiful Charlottesville. We have over 8,000 employees in the medical center, and I wanted to relay a little bit about people's false interpretation about either everyone's a nurse or everyone's a doctor. I want to talk to you about opportunities we have. What do you think? Who cleans the rooms? Who delivers the patient's food? Who escorts patients when they're discharged to their cars to go home with their family members? We have opportunities in a call center. And what a call center does is takes in many calls from referring physicians. They have questions about, a family member might want to know, what room a patient is in. Can you give me the phone number in the room? So the call center positions, all of these positions today require a high school diploma, GED, and 18 years of age or older. A call center, you have to have good customer service. I will say at the medical center, the positions that I'm going to go over require high school diploma or GED, but customer service is our number one focus. We can train you. We can train you in the systems that we use. I can't train you good, excellent customer service. That is something you have to bring on board. So the other things I want to go over is transporters. Transporters transport the patients by bed, stretcher, and wheelchair. You may take them to the operating room. You may take them to a procedure. So it's like when you're taking a patient, it would be nice to communicate to them. Realize that patient is laying in a bed and looking up at the ceiling. Talk to them, engage them. I hope you're doing okay. We're going into the elevator. This is the department we're heading to. So that's high customer service. We also have positions in Access Associates. I will tell you that an Access Associate is very high visible customer service. You are the first frontline person that a patient sees when they are going to register for a clinic appointment. They may come back. Now, an example is the cancer center. You're going to register a patient who has cancer. They're going to be distraught. You're going to have to provide that high customer service to make them feel comfortable. You register them, you take copays. Once they get done, you may have to make them a return appointment. We have other positions as far as greeters. Greeters, I will tell you, with COVID has changed a little bit. But greeters are your frontline individuals who help patients get out of their cars. They get a wheelchair, make sure they get to the place where they need an appointment. You may have to help them get off of a jaunt bus, to get to dialysis. So that's very high customer service. Along with COVID, though, which the restrictions are loosening, but you will have to take their temperature, make sure they have a mask. I'm still at the medical center or UVA Health. We are still requiring a mask. There's other opportunities as far as a health unit coordinator. Now, a health unit coordinator is almost like a secretary on the inpatient units. You would prepare charts for patients coming from the OR, from the emergency department, or just had an elective surgery. These are very high visible customer service. You are the first frontline person that a patient or family member sees. You're sort of the hubbub of the unit. You make sure that the nurses have their medication orders off the computer. You make sure you break down a chart when the patient is discharged. You would call for housekeeping if the patient is discharged. Dietary, there may be some dietary restrictions. So you are sort of, you have your ears and your eyes in the back of your head, sort of say. So you are sort of the hubbub of that unit. We also have patient care, well, we call them certified nurse assistants now. Now, I will tell you, let's talk a little bit about that technical piece that I was explaining. PVCC, K-Tech, they offer a certified nurse assistant program. These programs are short, maybe 3 months, and you would go through so many hours of class. You have to have 40 hours. You would do that in a long-term care facility. And then you would take a state exam. That starts you off if you have interest in working with patients and becoming a nurse. So those positions are just a little, require that certification, which doesn't take long, 3 months. And if you're very interested in going to become a nurse, then we could talk to you also about tuition reimbursement. And, in addition to, the greeters and the transporters, we have information desk greeters. Now, they are different than the front door greeters. They are the ones, if you've ever been in the medical center or in a hospital, that they are the ones who tell you where the patient is and what room. They also stamp your parking ticket. And so they don't leave the desk. So if you're the kind of person that doesn't mind sitting at a desk for like 8 hours, some people may have a disability and need to sit all day. Well, there are opportunities out there for you. We have people who, they sit at the desk all day. And same with the access associates. You have to stay sedentary in that station. So if you know of anybody or yourself, or there's anybody who has a disability that needs to sit, those are the kind of opportunities that you would really benefit from. Another position we have is a monitor technician. Now, it is a high school diploma, GED, and basically you're monitoring the vibes and the rays of a heart. So what you're going to do is you're going to get training on site in your department. And the supervisor there is very good. She trained you. That's another opportunity that you might not have thought about, because remember, everybody's heart has the same rhythms. But that's a really good opportunity of being a monitor technician. I want to go into, some people don't want to be around a lot of people. Some individuals might want to work in the labs. We have something called a specimen management technician. These positions, you are in the lab, you are making sure that the label is with that patient is on the right specimen and the order sheet is correct. You process certain specimens, and you have to realize that 800 patients and everybody's having a test. So that's a really good job as well, specimen management tech. We have, phlebotomists. Now, what phlebotomists do is they take patients' blood. That's a program that you can go to PVCC for. So there's lots of really good opportunities. And like I stated from the beginning, please don't think that everyone in the hospital is either a nurse or a doctor. It takes a village to work this whole hospital, and people that you don't even realize, what they do. And I'm always willing to, give you my email address if you had some questions about, the medical center. We have roughly, I would say, 8,000 employees. And don't ever think that you're not valuable. Everyone in our medical center is respected, and we do believe in fair across the board. Something that I did want to go into just a little bit this morning or this afternoon is that these are full-time positions. Our minimum rate is $15 an hour, and we provide full-time benefits. Now, that means a lot. Now, that being said, let's state one thing for sure. We are a medical center, so we are open to 24/7. And what that means to you is you may not get a Monday through Friday, 8 to 5. But let's say you wanted to take a class, or, you have children, I don't know, you have some kind of circumstance that you can't work days. Well, we have evenings, we have nights, we have weekends. One of the positions that I wanted to go over as well is called a patient companion. Patient companions sit with patients who are high risk fall. And the reason I want to mention the patient companion is because you can work at 3 p.m. to 11 p.m. You can work 11 p.m. to 7 a.m. And because of COVID, a lot of parents had told me I can't interview because I don't know if my child's going to go to school this year. So, that's where the flexibility comes in. And also, I've had circumstances where a couple only had one car, so he would work days and she works nights. And that gives them the opportunity to be home with the kids, homeschooling because of virtual school, and they both have full-time jobs with full benefits. So like I said, there's so many tracks that you can do. I would like you to go out on our website and look at the positions. Again, when you read a title, please read the job description, because sometimes it doesn't always match what some of the specific job duties are. So for instance, if you were interested in possibly working in the operating room, they're supply specialists, surgical supply. And what they do is they make sure that all the trays, everything is stocked for the operating room. So patients, when they go to surgery, the physicians, the doctors will have the kits all ready for that operation. Now, in addition to that, how did that instrument get to the operating room? We have a division as well, and it is basically what you're doing is sterile processing. You would sterilize all the instruments through the whole medical center for patients who are either in the clinics or the operating room, and you would have to clean every instrument, and you would have to learn what parts of this instrument goes into a box for a specific procedure. So that is very intricate, and if you're the kind of person that you want to be specialized and just be very strict on what your daily duties are, that's a perfect role for you. Again, being full-time and full benefits. And, I want to go into a little bit about the benefits. There's paid time off. So let's say you're a full-time employee working 80 hours every 2 weeks. You would earn 8 hours of paid time off. Paid time off means to you, it could be vacation, it could be sick time. So if you look at that, you could come into the medical center as a new employee, and your average days of vacation time is 26 days a year. We have full-time health insurance, we have dental, and we have vision. We have retirement, we had tax-deferred annuity program, and life insurance. I know I said that many years ago. I guess I'll take it all. Well, lots of years later, I'm fortunate to have had that retirement plan. So, I just want you to think a little bit about the medical environment. And I want you to think about what I said today, as far as there's positions that I didn't even realize that were out there. And I wanted to make sure that you have any questions, you're welcome to email me and I will answer them. I'm happy to send you a job description if you have some questions about it. I've carried a lot of different careers in my life at UVA Health. And just think about this. You can start off as an entry-level position, $15 an hour with full benefits. You don't have to leave. You do not have to leave the facility. You can actually transfer and you can be promoted. You can work, look for other positions within the institution. We just ask that you stay in your current role for 1 year, because if you think about it, it's taking you a year just to get into the policies and the procedures and how UVA works as a whole. And after a year, you think, oh, I want to try something different. Apply for something else. Now within your department, think about this. For example, sterile processing. There are certain ladders in certain jobs. So you could come in as a sterile processing technician. You can become a lead sterile processing technician. You can become a supervisor. So there's many opportunities. Access associate. There's a ladder there. You can go from access associate, you can go to a senior role, you can go to a supervisor role, and you can go to a manager role. Never limit yourself on the opportunities at UVA Health.
This is really exciting, Pam. Thanks so much for kind of just explaining the different structure and how UVA Health is. I love how you say that. Just don't think that the UVA Health is just with doctors and nurses, and that's it. And so for everybody watching and watching the recording too, I kind of liken it to a concert. You go to the concert and you just see the band, but you don't know there's sound behind it. You don't know that there's staff behind it. That makes the band look so good. Mm-hmm. And you would turn around and take a look at the sound guys if the sound was terrible. So there's so many things going on behind the scenes at UVA Health that is good for you guys to hear about. And I think also the opportunity to really start working your way into a career. And Pam, I just wanted to ask you personally, what was your first job right out of high school?
Oh my goodness, out of high school. Well, I worked at a drugstore.
Okay.
When I was in high school, I worked in a drugstore.
Okay.
I actually was a pharmacy technician.
Ah, okay.
So when I first started off, I was a pharmacy technician. And when I applied at UVA many years ago, that back in those days, you had to transcribe medications and everything. And I had known my medications and my frequencies and all that. So then I went up to UVA and I became a health unit coordinator. After 2 years, I became the supervisor of the health unit coordinators.
Wow.
And then after that, I ended up being an executive secretary for one of the leaders at the medical center. And then the medical center broke from the state and we created our own human resources division.
Wow.
And then in the meantime, I also went back and got my bachelor's in business administration. Yes, I was an adult because when the time I graduated, and if anybody can hear me, you didn't know what you want to do. Okay. So like I said, if you're the person that goes to college, great. or you go technical, or you go entry level. Okay. So I went back and got my bachelor's in business administration, and then we started our own human resources division. I also am a CNA, certified nurse assistant, and I worked in HR all week, and I did night shift on the weekends on the units because I wanted to make a difference in our patients. And that's what I'm telling everybody today. Don't think everyone is a nurse or a doctor. You know, I would have to go into those patients' rooms and say, my name's Pam. I'm here to help you tonight. I'm here to assist the nurse. Okay.
Yeah.
So then I've been in human resources and recruiting for over 25 years.
Okay.
Supervised, senior recruiter, you know, just a great experience in my life at UVA.
That's awesome. So it seems like there's a common thread throughout your whole career. It's just medical healthcare. You've been in through that. So what would be your suggestion then to your old self or to high school students if they wanted to, or young professionals, let's say, if they want to get into the medical field and the medical track, what would you suggest that they do?
Okay. Are you saying during school or after graduation?
After graduation.
Perfect. Okay.
Because just to clarify, you guys can only take over the age of 18. You have to be 18
Yes,
or older. Okay.
Yes, sir. Yeah. Okay. So my recommendation is either you go to college and you do it. My daughter's gone through it, got her master's. She's a whip. But anyway, but my suggestion is, and I'm going to be truthful with you, if you are a high school grad, not knowing which way to turn, and you decide, okay, I want to just start with an entry-level position at UVA. And then in a year or two, you say, wow, I think I want to go to college. Well, you know, when you're in that healthcare environment, for example, did you know that you could take x-rays? You could be a rad tech at PVCC. I mean, come on, you know, you then get into that environment, you realize, wow, I didn't know that, you know? So
Right.
sometimes, you know, I've talked to individuals as well who said, I didn't know anything about labs or being a, you know, medical technologist but a friend of mine was explaining to me what she does in the lab. So there is also a career site, I believe, online, and it's over 300 medical positions in the state of Virginia. So it would give you a little example, like if you typed in labs or radiology. So, you know, again, my recommendation is think about this. You come in, you're making $15 an hour. You have full benefits. After 6 months of employment, you can get tuition reimbursement. Okay. So, you know, I have many friends who started off as certified nurse aides, went and got their associates, got their bachelor's, got their master's, and got their doctorate. And UVA paid mostly for everything.
Wow. So it's a better way. Well, I wouldn't say better. It's another path or a way for students to really kind of get into the company, explore their careers while getting paid and the benefits. Specifically, if you're interested in the health science, health medical field, where you could get paid and start really working your way up in the company and in the industry, because I think that is such an awesome opportunity for these students. Now, is there any opportunity for, let's say, anybody younger than 18? What would you suggest that they do?
Okay, that's a perfect. Thank you. We have, and this is where you can get that experience in a hospital environment. Junior volunteers. Okay, it is probably not last year, but this year. You know, I'm sure they'll start getting that junior volunteers. Now, what they do is it's a training program. It's a couple days training, but you can deliver get well cards. You can deliver flowers. We actually had a couple volunteers in human resources doing filing. It just gives you that sense of this is a medical environment, healthcare. Yeah. Yeah. So the junior volunteers have been excellent. And to be honest with you, you know, I had many college students who were volunteers as well. So that's what I can recommend for anyone under the age of 18.
Okay, that's a good program, Junior Volunteers, and they can find that at the UVA Health
Yes.
website too.
Volunteer services. Yes.
Awesome. Well, as we come to a close here, Pam, is there anything else you would like to say before we close this session?
Well, Seth, I'm just not very talkative, but no, but seriously, I think that, okay, let me be honest and truthful with you. No, I don't really want people to be ill.
Yes.
Nor do I want them to, but remember that the health of our nation, COVID has put a lot of stress on some people. But overall, if you look at statistics, the 60 is the new 50. So if you're 60 years old, you got that 50 vibe in you. Okay. but and I hate to say this, but people are always going to be sick. And I don't want to say that, but people are always going to need medical care. And if you want a substantial, steady position, I can't tell you all enough today how much we've expanded and how much we need individuals to work.
Right.
And just like I hate to say, but grocery stores, you got to eat. So, but healthcare is, you have to also think of one thing. Like I said, customer service and compassion is what you need to work at UVA Health.
Yeah.
An example is, I'm going to give you a story. I was walking through the lobby at the hospital one day. This family came rushing in. A family member was ill. They drove 4 hours, still had on their slippers, just distraught, tried to comfort them. And, think about if you didn't live in a town that had a level 1 trauma center. You've got patients and families coming in who don't know the area, don't know where to stay, don't know where to park. You got to have that compassionate side to say, let me help you. Let me help you. So just think about that compassion piece for me. Mm-hmm.
That's really good. Well, thank you so much, Pam, for your time. And thank you everybody who joined us. And we look forward to the next session that you'll see live when we talk with possibly get into other departments there at UVA and hear from other people too. But this has been really informative, Pam. Thank you so much for your time. And until next time, check them out too at qden.us. You'll see them in their profile and all their opportunities that they have to offer. Yes. Thanks, Pam.
QDen. Have a great day. Thanks, Seth. Thanks, everyone.
Take care.
A wonderful